How would you like to pass SCA and finish your training? Hi, if you're new here, my name is Dr Erwin Kwun. I help doctors pass the SCA exam. Today I'm joined by Dr Sathya, a newly qualified GP who recently passed the SCA exam. He had a lot of trouble with the SCA preparation. He struggled to consult within 12 minutes. Time management is a major concern that trainees have with their preparation. In this case study, you're going to learn step by step what Dr. Sathya did to prepare for his exam and how he overcome the challenges. Make sure you watch this video until the end to learn the insights from Dr. Sathya. Hi Sathya, how are you doing?
Hi, Erwin. I'm fine, thank you.
Could you introduce yourself for people who might not know you?
So I'm Sathya. I'm actually finished my GP training. I'm based in Scotland, so I'm just starting my career as a newly qualified GP. So looking excited, and I should thank Erwin for helping me to get through this SCA exam. So I'm just going to share my story with you guys.
How did you approach the SCA exam, Sathya?
Yes, to be honest, when it's a new exam, I was not entirely sure how to go about this. When you see the question banks, there are a lot of many different cases. So in general practice, you have your own style and you've been doing consultation, but when it comes to the SCA exam, it needs to be more structured and it should be very precise. And I had a bit of a difficulty with time management, particularly because I had a much more relaxed way of approaching every patient. So when it comes to the exam, I always struggle to finish the cases on time, and my consultation is it's not very structured. I'm not sure how to go about that. So I was just trying to get some type of support. My practice helped as well, and then I thought I need to work on myself. So I found Erwin and we had a discussion. And I went through his website. It actually really helped me, the PowerPoint presentation, which everything included, how the consultation should be. And then we had some one-to-one session, which actually he was able to point out what's going wrong. And I tried to work on that in my day-to-day practice. So I just stick with the structure which was agreed on during our session, and I used the same structure to see the patients, and actually it really helped me.
Yeah, so let's go into the structure, because I remember there was a little issues with the organization. Previously, how were you doing it, and then what did you have to change, Satya?
Yes, so it's normally the one important aspect is the psychosocial aspect, which I tend to miss a lot, but which is quite important. But as because I practiced before in the emergency department before I became a GP trainee, where things are very fast. You don't need to have look into the psychosocial aspect a lot. But in general practice, that's a major thing which you need to address, because the whole chunk of the consultation just might be hidden under that psychosocial, and I kept on missing that. So obviously when you miss that, these things comes towards the end of your consultation, and I struggled a lot. And also there was times I was asking the psychosocial questions oh, I need to ask, so then I just jumped in advance, and it also didn't look like a very good consultation. So you need to be well aware when to ask that, and to the patient, and it also changes from each case to case. So those things comes through the practice, and honestly the model cases which has been given in the website, which Erwin did with his actors, is really helpful. And I watched all those videos, and that actually even helped me in my exam when I get some cases which I'd never seen in my life, or when I discussed with my supervisor, oh my God, I don't know how did you manage that? But apparently when marks come, that's one of the case I scored really well. And I think you just need to follow the structure, and if you have the structure, you can manage any case. You don't need to really know the whole lot of knowledge about that particular case actually.
Yeah, I'm glad that you raised that, because I remember there are some cases where you were telling me that when we were doing the mock, when it comes to things you're not sure about, you tend to find it difficult, and that's where things get worse. So then, how did you manage the uncertainty then?
So the main thing is like I kept my nerves calm, like because like I had this anxiety kicks in. Oh my god, this case, I don't know what to do. When you get anxious, then the whole flow, the rapport gets lost with your patient, and you sound like more like not a very confident clinician there. So just like go with the flow, like I would say, like just keep asking the questions what you need to ask the patients, rather than or what I should do for this particular case and things like, because if you're having a second thought going at the back of your head, you I struggle personally, like what I should ask the patient, and again that loses the structure. So that one thing I learned only from practice, particularly like when I did the one-to-one session with you. I don't know what the case will be, and you just like change from one way to the other as well. So you always like make things harder, but I think that's the way I was able to gather and gain that confidence and skill to approach any case.
I see. Yeah. So listening actively is very important because the patient in the exam will lead you to the next thing, and this is how you can pick up the cue. How did you find about this listening aspect and improve your skill with that?
So I always like give the open questions to the patient, let them talk at the beginning, and I never try to interrupt even the time is going little, because sometimes patients can talk much, and particularly there are like cases where sometimes you can have like patients, a difficult patient. In that case, you can't, and the key is how you're going to be managing that. If I lose that active listening in those cases, then obviously that's not going to help me. So when the patient is not agreeing or anything, you're running out of time, still I would say like just stick with the active listening part. Don't try to put yourself in pressure, say that, oh, I need to finish, I need to do this, because sometimes that case just may be how you're handling the difficult situation rather than how you're finishing. So I always like let them talk, listen to them, and ask them what they actually want and what we could offer, and always like just like give a follow-up plan. So those are the things.
So getting the patient's health agenda is important, and readdressing it in the clinical management is very, very important. How would you like to have a playbook that over 200 GP trainees have used to pass SCA exam? If you'd like to download the free copy of the SCA blueprint, click the link down in the description and you get a free copy, and I'll also give you daily teaching for the next 7 days. Click the link and you'll get it for free. How did you integrate your ideas, concern, expectation in the clinical management, Satya?
In my clinical management, one of the phrase I actually learned, I tried to use that is like after listening to the patient a lot, like I just summarize, and it's also you mentioned this phrase in your thing, like saying that I know like what might be going on here, but like I ask them like what you are actually hoping for, and then like I will say like, okay, you might be thinking this, but I think this is things, why don't we do such and such thing for this, and then if still not you're happy, then we will again speak with you like again a week's time or something. So that gives more confident about, even though like patients sometimes have an unrealistic expectations, but providing your thoughts initially and saying that if you're not happy, then we can come back again, revisit your thoughts again in a week's time. So that actually really helps the patient. Even in real life practice, I start using that, and it makes a huge difference when patient comes and asks you for some scans and you tell this and this. It really like gives that trust in you. So that's how I try to use those.
That's a really useful tip. So, when we break down the timing, then, how long did you give yourself in clinical management?
So that's a tricky thing. I try to use most of the time for my clinical management, but there are cases where I would say like the big chunk I will use that for the clinical management, because mark wise it scores a lot as well. Um, so again, it is case specific, it's hard to tell, but I would say like it's in a 12-minute consultation, I would definitely give at least 4 to 5 minutes full for my clinical management to clearly describe that.
So yeah, clinical management is more heavily weighed. That's why it's so important to give yourself enough time. Otherwise, you rush it or the management plan is inadequate. So when you think about the priming phase before going in the consultation, did you also prime the clinical management?
When I priming the case, like when in the exam you get the question, like there are like very minimum information for that question, so it's hard, like you really don't know much, like there will be like very few things. So in that situations, what I would say, don't think too much what it could be, because that will create like a lot of anxiety again. Just like stay calm. Okay, so there is no much information, so it could be anything, could be a simple thing, could be a for example, it could be a child protection, or like safeguarding issues basically. So those type of things I would always think about when there is a details or minimum. And in this particular exam I've seen, when having a case, like there are like multiple issues patients brought up as well, and I tried to address those issues, and I was like very concerned. Oh my god, why the patients talking about 2 3 issues at the same time? And in the management I gave them all the management, but apparently I scored well in that as well. So don't think too much about when you're priming the case. Just like if you have any information, good. If not, just keep cool.
So it's important to expect the unexpected, because you might see a case briefing and then when the patients start talking, it's completely different as well. So you mentioned something very important, as in about the anxiety. Yeah, it can be overwhelming when you're reading it and you're thinking. So were there any things like you found quite useful when you were thinking about how you manage the stress of exam?
With the stress of exam, like obviously, like I would say, like the more you practice, the more put yourself into that situation. um, it is really helpful. For example, like when it comes to the whole program, like when we have this the 12 cases which we do with the patients, I think like when other people are watching you, uh, and when you're doing cases well, in those situations, actually I think like I did a couple of cases when I was doing the 12 cases. Just because first case I didn't do well, but the second case I gathered the confidence as well. So I would say like you need to put yourself into the pressure of like the time pressure, and practice with many different people so that you don't get comfortable with one particular person when you're doing the case, and that way you can eliminate that anxiety, gain more confidence just to handle whatever comes in your way.
Great. And how long did you give yourself to prepare then?
A month and a half, couple of months, but I know like I rushed my exam quite a lot because I was towards the end of my training. But I would say like a good 2 months practice should be more than enough, but you should be quite regular practicing the cases.
Can you tell us about the system that you use to make sure that you were doing it smart and making sure that you're working on these areas of weakness?
As I said, it's through the practice, and obviously when you're finding someone to work on your weakness, uh, you can practice at 3 4 cases in a day, but you should try and use that in your day-to-day practice, because with these real patients, when you're trying to use this structure consultation, that gives you more practice. And yes, the smart structure is quite helpful as well. Yeah,
Practice is very important. It's important to practice intentionally and working on these areas of weakness. Could you tell us what was your results, Satya?
yes, I scored like 79.5, I think so.
7945. And that was your second attempt, I understand, right?
Yes, I lost by 1 mark in my first attempt.
Mm.
Yeah, so last time I got 76 and the pass mark was 77. Strangely, this time the pass mark was 76.
Okay, yeah. So you got enough to pass exam, and how does it feel now that you're on the other side?
Yeah, it's yeah, actually like I didn't lose much hope when I failed in the first attempt, because then I went through um, the feedback from them, and then I had a discussion with you. It just like the certain things like I find it difficult to adjust initially, but then like after having a chat with you, then I tried to I found the area of weakness, because as a male GP I wasn't doing much on women's health, and I put myself practicing women's health as the admin to book more patients so that I can have that flow. Because when I initially thought like, okay, I'll read about this case, at the end of the day the clinical management is okay, but I couldn't develop rapport with these patients with the area of weakness, and that's where like I lost in my interpersonal skills. My data gathering wasn't good because it gets chaotic, because I was not practicing that a lot. So I would say keep practicing in your day-to-day practice as well.
Right. When it came to the coaching then, how did you find the experience of being coached?
Yeah, it's very helpful, and initially like I had a difficulty because there was a huge change. I need to adapt to the style and structure. It is a difficult to completely change, but when you are like quite happy to accept and try to correct yourself, it will really help you. And this is mainly important for your time management, because in the exam the time is the most important thing. And the other thing is like, you should never think about the previous case. What happened is happened, so don't think too much. And that's one thing I gained through the coaching, because first case done, then the second case comes, just keeps going on that. And those type of like fine tuning my brain, like not to worry about what happened, and those type of things, and getting some positive feedback, and feel encouraged about that, and don't get discouraged when you get a negative feedback, and try to improve on it. And the next session I try to work on that and try to produce that to get the positive feedback. So in that way, like it is quite helpful.
Great. So what would you say to somebody who was not successful in the last attempt and trying to prepare for a second attempt, Sathya?
I would say like what happened is happened, and you need to take the positives out of that first exam, and then like try to have a chat, have a think about it, what went wrong. And when you are trying to work on your weakness, please don't forget to, you need to still work on your strength as well, because like if you stop doing that, and then like probably next attempt you might struggle with that. Because I did that mistake, not in the exam, but like while I was practicing, I just like focusing on my mistakes, and I thought like, okay, this area I'm good, so I don't really need to worry about that. uh, but then like I realized, oh my god, okay, so I'm losing touch in this, so I need to do that. So even though while you're working on your weakness, don't forget to, you still need to work on your strength, because in exam you need to be make sure that you're giving your 100%. And obviously it's not about like scoring very really high, but passing each station is more important.
Great. I think it's really useful to hear your experience today, because everybody practices and prepare differently. And for somebody who might not be successful and have so many thoughts and self-doubts about this exam, seeing that you've managed to pass despite the challenges is really inspiring. And I understand that now you're looking to start working, and you've got a job that you're preparing to. So what are you looking forward to now?
I'm looking forward to start my career in general practice. So I'm actually looking to do like a career start GP job, just to gain some special interest as well. It is quite useful actually, I would say, because as a newly qualified GP, when you walk out of surgery, you will now be more independent. You need to do things. So there will be a bit of an anxiety, but taking a career start and knowing the system much better is again a useful thing, I would say.
Great. Thank you very much. I'm so pleased to see that you've qualified as a GP. And if you watch this video up until the end and you'd like to have more information about the one-to-one coaching, please click the link down below and you can get more information about the one-to-one coaching. Thank you very much for sharing your story today, and take care, everybody. Bye-bye.